Welcome to this webinar discussing attention and executive functioning skills in individuals with epilepsy. Before I introduce our speaker for this evening, I just wanted to tell you a little bit about what we do here at the foundation. So we've been the EFEPA for 50 years and counting. We're a local independent affiliate of the Epilepsy Foundation of America. You can see our service areas, the 18 counties of Eastern Pennsylvania. So we have a lot of free support and services and programs and resources and referrals for you in case you're looking for some support. Here's just some of our programs that we have. We do seizure recognition and first aid for just about anybody who wants it. So it could be businesses. A lot of times it's teachers, nurses, school nurses, first responders. We go out and do that. And like I said, everything we do is free of charge. We have monthly support groups throughout the service area. Most of them are Zoom right now. So we get a lot of people from different states. Same thing with our educational conferences and our webinars. So you can tune in from anywhere. We had to reschedule the meeting from last week, but there were people from 5 different countries that signed in. So I love to see that. So we also do consultations. Let's say you're looking for some help in finding a doctor, information or referrals. Can you help me? What's in the community to help me? We can work with you on that. We have mental and behavioral health programs. The best thing to do is to sign up for our newsletter, and you'll find out all the different programs and services we have every single month. Educational conferences, community building and awareness events, youth. We even have youth and young adult and adult programs, and we have retreats and camp. So that's just some of the things we do here at the foundation. So if you want to be more involved, you can maybe, we can provide educational opportunities like seizure recognition and first aid for your school, your workplace, any first responders, police officers, anything. We have community events. Upcoming is a 50th anniversary party, Friday, September 30th. Then we have a walk to end epilepsy in the Northeast. That's Wilkes-Barre-Scranton area. That's October 15th. And then one in the Lancaster area for October 22nd. And you can help at any time, raise awareness and share your story through either our social media or volunteer. We're always looking for volunteers. So the way to keep in touch with us, this is our address. Go on our website, efepa.org, and sign up for our newsletters, and then you'll find out about all the things that we do. So I'm proud to introduce our speaker for this evening, Hilary Murphy. She is a licensed clinical psychologist and formerly trained pediatric neuropsychologist with a specialization in the neuropsychological assessment of children, adolescents, and young adults. Her training in school psychology also provides her with experience and expertise in collaborating and consulting with educators and other professionals. She adopts a multifaceted approach to neuropsychological assessment, which takes an individual's culture, their social, emotional functioning, their cognitive profile, and academic performance all into account to develop a holistic understanding of each patient's unique presentation. So welcome to Hilary, and I'm going to sign off a little, not sign off, but I'm going to disappear. Thank you, Hilary.
No problem. Thank you guys so much for having me. So I'm going to get ready and share my presentation here. And just so you guys know, I will be making some slides available for anybody who's interested in them after the talk today. And I'll definitely be just kind of keeping some time at the end for any general questions. I'm really excited to be able to talk about this.
Oh. I'm so sorry. I forgot to mention that if they have any questions, they should put it in the chat box.
Perfect.
I will collect all that. She won't be answering these questions as we go along. I'll ask them at the end of this presentation. So sorry.
No problem. Thank you so much. Excellent. So I love talking about this issue because a lot of times parents will come in, talking about all of the things that they've done, working with their child to kind of manage aspects of epilepsy and seizures. And oftentimes other areas of functioning, particularly how a child is essentially getting by in life, getting by in school, making friends, doing all of these things that kind of come after stabilization or talk about aspects of quality of life sort of can get put to the side. A lot of times I joke about the fact that most people don't really know kind of what a neuropsychologist is until and unless you get referred to somebody like me. So generally, one of the first questions that I like to start with anytime that I have someone coming in my office is, what exactly is a neuropsychologist? And there's a few different learning objectives that I was hoping that we could try to cover in the time that we have together today. One of those first ones is, what is a neuropsychologist? Who am I and how do I help individuals, especially people and their families who are dealing with the life, that comes with having someone in our lives that has epilepsy. I want to talk about what are some of these attentional issues. When we talk about some of the, attentional and executive functioning deficits that can come along with an epilepsy profile, what are they? What do they look like? Are they consistent with someone who has, ADHD that doesn't also have a history of epilepsy? And I also want to talk about some of the other aspects of life involved in living with epilepsy that can contribute to or exacerbate areas of attentional kind of issues or executive dysfunction, and then how we can use some of the information that can be gathered through a neuropsychological assessment to help to plan forward. What can we use this information to do? How do we support people in our lives who are struggling with these areas of functioning? So let's start with the most basic thing. What is a neuropsychologist? Usually when people come into my office, the way I like to explain it is that it is my job to understand how people learn and see the world. The way I do that is I give a lot of different essentially tests. Sometimes I use the word activities. Sometimes I talk about, tasks that I do with people. I try to avoid games or puzzles just because, let's face it, the games that I have aren't as interesting as something like Minecraft or some of the games that children coming into my office are more familiar with. But really what I talk about is that I want to learn how someone learns. I want to know what's great about your brain, and I want to know what are some of the areas that we can help to support someone in to get them to achieve the goals that they set for themselves. For older individuals, I like to explain this as kind of a path of self-discovery. I help you to understand the way that your brain uniquely processes the information in daily life. And that can be a really kind of wide range of things. So oftentimes when we talk about what it is that we're looking at in a neuropsychological evaluation, outside of just what I see on the tests that I administer, and we're going to talk about some of the areas of cognitive functioning that I typically am looking at when I'm working with someone for a neuropsychological assessment. I also want to know, what is their medical history like? What kind of medications, if any, are they taking? What are some of the behaviors that parents, or what I think of as, collaterals in a person's life? So for older individuals, that might be spouses, that could be friends, siblings, family members who know people well. What have they seen, kind of from day one or over time as either impacting or assisting an individual in being successful in daily life? I want to look at their behavior. How do they interact with me? What are their language skills like? What's their eye contact like? Are they comfortable? What's their mood like? How do they present in kind of daily life in this really structured setting? We take into account aspects of culture and language because certainly we know one size does not fit all. And we really try to understand that there could be certain aspects of an individual's upbringing that could be brought to bear on how they're functioning in terms of daily life. And that can help us to best interpret, their reaction to or their response to some of the aspects of neuropsychological evaluation. And we also will look at, either reports from teachers, in some instances, reports from workplaces, depending on an individual's age and kind of functioning. And we take all of that together and we try to build this comprehensive profile of who someone is, where have they been, what has worked in the past, what are some of the areas that we want to keep supporting them in, and then we provide recommendations of what that looks like. So typically I'm working with school-aged individuals, and that for me can range from elementary school, middle school, high school, and for some individuals that I work with, can be up into college age. So a lot of the things I'm going to talk about today are really focused on that age because it's the most common one that I am working with. And so a lot of the techniques that we're going to discuss today and some of the broad strokes of some of the interventions that we usually will discuss as a result of these evaluations is really going to focus on kind of anywhere from like elementary up into entering college. So just keep that in mind. Now, I mentioned before, I look at what's called cognitive functioning, and cognitive functioning really is a broad term. We look at aspects of IQ or intellectual functioning, and that can be broken down into how well do we reason with words? What's our general knowledge of facts? How well do we reason with shapes or patterns? Can we use visual logic, think outside the box? Solve problems? How quickly do we take in information? What's the speed of our processing? We want to look at aspects of language, both our ability to express our thoughts and ideas, but also understand what is said to us in daily life and see, is that something that's getting in our way? We want to look at fine motor skills. This can be really helpful for individuals where we know that there's a history of epilepsy, because in some instances, we can see, areas of motor functioning being impacted depending on where the seizures may be originating from. In addition, we want to look at aspects of the attention and executive control, which we're going to be talking a lot about today. We look at areas of memory, in some instances, academic abilities, so assessing learning disabilities, things like dyslexia, dyscalculia, dysgraphia. We want to look at social skills. So one of the most common referrals that we get typically at NeurAbilities is the question of autism. And certainly when we're working with a population that has a history of epilepsy, we know that there is this relationship between epilepsy and autism where the risk of having one goes up if you have another. They tend to kind of coexist in some individuals. We want to talk about mood and behavior, not just because we understand that living with a chronic illness has in and of itself its own stressors, whether it's kind of family-wide, individual-wide, but also we know that some expressions of seizures can be, episodes of anger, episodes of sadness. And so we really want to document that so that we can make sure that we're supporting an individual in multiple areas of their life. And then we also want to really understand what we think of as adaptive functioning. And adaptive skills really refer to all of the abilities that we need to be independent. How well do we take care of ourselves? Can we, kind of keep our household or our space clean? Can we remember to do things for ourselves in terms of hygiene? Can we kind of interact with our community and be able to navigate social situations and essentially be able to function at home, at school, and then eventually vocationally? And like I mentioned, we take all of this together and we say, okay, how do we want to support someone? Now, within the context of our organization, one of the strengths that we have is that typically I, as a neuropsychologist, am working with a physician, whether it's a neurologist or a behavioral pediatrician or kind of a developmental specialist, or I may be working with an advanced nurse practitioner to weigh in and work collaboratively on cases. So oftentimes when people come through our kind of service, they'll meet with the physician first. And if the physician feels that it's warranted, they can, refer to neuropsych, and then we're able to collaborate on the case as we move forward. And one of the things that I think really makes it important that a neuropsychological evaluation is, considered in an individual with epilepsy is that it can go beyond just the medical piece. We know that epilepsy is the most common neurological disorder that is impacting children and adolescents. And certainly we know that many children, many individuals can achieve appropriate seizure control. They can live life without seizures on medication or anti-epileptic drugs. I'll occasionally use the abbreviation AED, referring to medications that are used for epilepsy or anti-epileptic drugs. However, despite the fact that we can achieve appropriate seizure control, that does not mean that there aren't also cognitive, emotional, social, and learning issues that can persist despite being able to appropriately control the seizures. This is where oftentimes we have, essentially this road that I always think of as a kind of two parallel roads. We have the road of medical stabilization and functioning, working with a neurologist, working with a physician who may be prescribing medications, monitoring medical functioning, and really being focused on keeping this person safe and stable medically. And the other track really involves everything else. How are we learning? How are we making friends? How are we functioning socially? How are we functioning as a family? How are we adjusting to the responsibility of managing a chronic illness such as epilepsy? And this is where the addition of neuropsychological testing or working with someone who's a clinician who specializes in this can be really, really helpful, because this is where we then can weigh in on, here's everything else that's going on and here's how we can help you. Oftentimes when we think about a disorder that is as complex as epilepsy, that can really take many different forms. We know that it can occur for some individuals in just one part of the brain. It can be more generalized or multiple areas of the brain are impacted. It can be very subtle, like absence seizures, where it can be as subtle as someone just using eye fluttering or eye blinking or having, these brief lapses in attention. Or it can be really pronounced and kind of overt, where someone may have a more of a generalized tonic-clonic seizure where there is stiffening, shaking. What I usually think of as the stereotype of what we assume is something like a seizure. And knowing and understanding how to work with such a complex medical issue is one piece, but then understanding that there's all of these other cognitive things that often co-occur in an individual with epilepsy is sort of another one. So certainly we know, like I mentioned before, autism is one of the things that we tend to see that can co-occur or exist alongside something like epilepsy. We also know that mood issues, learning disabilities, like I mentioned before, intellectual or cognitive disabilities where an individual may or may not be able to live independently, and then something like ADHD and executive dysfunction, which is going to be really the topic that we talk a lot about today. Now, many parents and children who come in to see me talk about, why is it, if the seizures that I have are kind of happening in one part of my brain, why is kind of everything being impacted? Oftentimes I talk to my students about the fact that anytime something is going on at the level of our brain, the likelihood that we're going to see impacts on attention it skyrockets. Whether it's that we have a blow to the head, whether it's we have seizures, whether it's we're tired or sleep deprived, or we're very hungry, or we're not motivated, or we're stressed. And it's because the best way to understand the brain is kind of working together as an orchestra. Oftentimes, we think about the brain just little parts of it controlling certain aspects of our thoughts or our behavior. you know but in reality, it's best understood as multiple things coming together, multiple areas of our brain working together to produce these really complicated behaviors. So, in order to be able to focus, all of the things that we have to do are involved in not just kind of the foremost part of our brain, the prefrontal cortex that we're going to be talking about in a minute, but really rely on all of these other pathways in our brain. And usually what I like to use as a metaphor is that if you have an orchestra, and let's say one part of the orchestra is impacted, so the woodwinds are impacted, the rest of the orchestra can play the song, but it's not going to be right. Something's going to be off. The timing is going to be off. And it may be because there could be parts where, that kind of sound should come in, or that, the woodwinds are supposed to come in and they trigger, percussion or whatever other areas of the orchestra are supposed to add in to the song might be a little bit off time or off kilter, or it just doesn't sound right. And it's no different when our brain is trying to produce a behavior as complicated as attention, because we always think about attention as just being laser focused on one thing. And in reality, it's a lot more complicated than that. It's a very delicate system in our brain, and it can really be impacted by anything else that's going on. If you've ever had, a really poor night's sleep, if you've ever had to go to a work meeting or a class or something when you're really hungry or worried about something else, you know that your learning and your attention is not going to be as good as if you are well rested, happy, engaged, and interested in what you're doing. Well, if those kinds of really kind of simple things can interfere with attention, then it's not surprising that if we have something as complicated as seizures, where there's unusual electrical activity in the brain, well, then certainly our attention is going to be impacted also. And so that's something always to keep in the back of our mind, is why we see these things happening all together. Now, I mentioned before that when we think of attention, oftentimes I explain this, that people sort of think about this as an attentional vacuum. They think, oh, I just have to focus on this one thing. And we don't realize that there's actually a few different steps in attention, and that when we are focusing on one thing, at the same time, we are kind of drowning out or ignoring anything else in our environment that we don't want to look at or that we don't deem as important. And that's really essential for us to understand when we think about someone who struggles with attention. So for example, you're listening to this talk and you may be in a room where, perhaps the door is closed, but you can hear other members of your family outside the door talking, walking, doing something else. Maybe you can see out of the corner of your eye something in the window that's happening, whether it's a swaying tree or someone walking past your house. You're not even paying attention to the fact that you are actively, ignoring all of these other things because you're trying to listen to my voice. You're trying to look at my PowerPoint slides. And that's something that's really important, is that for you, as someone who may have really good attention, you're doing that without having to really think too much about it. But for individuals who struggle with attention, they can't simultaneously filter out all of these things that aren't as important. So if you imagine a child in a classroom where the teacher is talking about something, but something's going on outside the hall, it's almost time for lunch, the person behind that child is maybe tapping their foot or clicking their pen, and they're really getting worked up about, oh, I want to be able to be the first one in line for lunch because today is pizza day. And it's really easy to see how a kid can kind of get stuck either in their own mind, kind of distracted by their own thoughts, which we think of as more inattention, or they could be a little bit more obviously distracted. So the child that's kind of looking around the room or is a little bit impulsive. Now, like I mentioned, there's a few different skills that's involved in attention. There's attention span, which is essentially how long can you pay attention for. We talk about brief attention span, that's several seconds up to a couple minutes, and then kind of more sustained attention, which for older individuals can be upwards of 15 or 20 minutes of focus at a time. Being able to divide our attention, essentially being able not to multitask. A lot of people think, oh, this means, I can do two things at the same time. Not really. No one really can adequately do two things at the same time. What we know is that we can switch between two equally important skills. And the example I like to give is taking notes. So again, let's go to the example of you listening to my lecture. Well, you might be simultaneously listening to me and then you're taking notes as we go along. You're actually kind of switching back and forth. You're paraphrasing what I'm saying into your own words, and then you're coming back to the lecture. That's kind of more of this divided attention where we can move back and forth. And then again, we have selective attention. And one of the things that I always like to emphasize is that in order to pay attention, we have to be motivated. Anyone who's been in a class that the teacher is either incredibly boring, or we do not like it, or we don't want to be there, or it's at 8 o'clock and we're really just not engaged in it, well, we're not going to be able to learn as effectively. Even if we have great memory skills, even if we're a great student, we're just not going to be able to really perform up to our potential, because there has to be some motivation piece, whether it's, kind of an adult motivation of, listen, I might not like this meeting, but I need to go here to keep my job, or a child being, really interested in a topic or activity and being intrinsically motivated to engage. Now, like I mentioned, the area of the brain that we often associate with attention and executive functioning, and we're going to be defining what executive functioning means in a moment, we usually associate it with kind of the foremost part of our brain, the prefrontal cortex. Now, one of the things that's really important about this area of the brain, like I mentioned before, it's not just being able to kind of focus in on something, but one of the most important kind of skills that it has is regulation, meaning that it's not just focusing on one thing, it's drowning everything else out, or being able to ignore other things. So really being able to do two things at the same time. Now, in addition, when we think about regulation, we also think about being able to regulate impulses, being able to regulate kind of our motor behavior. And so when we think about someone who has ADHD, or attention deficit hyperactivity disorder, a lot of the key issues really kind of come down to regulation, being able to regulate our focus, being able to kind of stop ourselves from, acting on impulse or interrupting other people, let's say, and also being able to regulate our behavior and maybe not be as restless or fidgety in a certain situation. Now, this is one of the last areas of the brain to develop, and one of the terms that we use is myelinate, meaning that nerves in the brain essentially have this really great little kind of protective coating that helps messages in the brain to move faster and to travel farther. That's what the myelin does. If you kind of work in kind of electrics or electronics, you know that oftentimes when we have wires that are well grounded or have a similar kind of protective coating, they're better able to send messages. It's no different in this area of the brain. And oftentimes, because we talk about it myelinating later on in life, so towards the end of kind of childhood into adolescence, people sometimes think that it's almost like, turning on a light, that all throughout childhood, that part of the brain just essentially isn't really doing anything. It's like a raisin. And then all of a sudden, you wake up on your 18th birthday and boom, you have a frontal lobe. Well, not really. We actually see that it's a process that develops over time. We're going to talk about that in a minute and why it's important for us to understand in terms of development and childhood. Now, executive functioning is this really broad term. We think about it as an umbrella term, and there's no one agreed upon definition. And the reason for that is that it kind of depends on who you ask, what they view as being a skill related to executive functioning. The best way to describe it, no matter who you might be talking to, is that executive functioning skills are all of the abilities you need to achieve a goal. You have to be able to focus on it. You have to be able to set realistic goals. You have to regulate your behavior and your performance to achieve that goal that you set for yourself. You have to manage your time appropriately. You have to be able to kind of plan things out. All of these things that we need really in order to be successful students and successful adults. Now, oftentimes, when we think about executive functioning, these are skills that become increasingly important throughout the lifespan. I've listed a few of them here, and I always like to give some examples of what they look like in day-to-day life, because a lot of times parents will come into my office and they'll describe some of these issues to me and not be aware that it's really related to what we think of as executive functioning skills. So, for example, sometimes I will have parents come in and talk to me about my child just can't get started on something. I have to remind them 5, 6, 7 times. And by the time that I'm hitting 5, 6, 7 times, I'm upset, they're upset, everyone's yelling, and everybody is angry. And then all of a sudden, we're really just not doing what we need to do. We already have another issue, which is essentially now we're frustrated, we're upset, my child isn't talking to me, and I don't know what to do. In other instances, I'll hear, parents or teachers talk about a child who is really academically capable, but they really never get all of the points for an assignment because they'll finish it, but then they don't turn it in. Or my favorite example is, there was a worksheet, there were 2 sides, and the child didn't even think to turn it over. And again, a lot of times these behaviors can be, misunderstood or misconstrued as a child not being motivated or a child being lazy. That term laziness gets thrown around a lot. I tend to see it or like hear it when I'm working with individuals. And I have to be honest with you, and sometimes people kind of chuckle when I say this, but I've truly never met a child that I've worked with that I would categorize as lazy. I have worked with kids who are defeated. I've worked with kids who are disorganized. I've worked with kids who struggle with learning. And I've worked with kids who really don't feel confident enough in their abilities to start things or feel so perfectionistic and anxious that they never finish anything because they're too afraid of having it be judged by someone. But I've never found a child that I've really categorized as lazy. And I think that that's important because whenever we understand why a child isn't performing up to their potential or why they're not kind of achieving the goals that they set for themselves or that we set for them, there's usually an underlying issue. And I think that that's very important. Now, I mentioned that when we think about attention and executive functioning, it's not a light switch. It doesn't just go off, the day before our 18th birthday. Really, what we know is that kind of the foundational building blocks of what will eventually become our focus and our attention span are, present as early as infancy. So I have a nearly 1-year-old daughter myself, and one of the things that was most fascinating in watching her develop was seeing her start to pay attention to things. And anybody in the audience who can remember their children when they were a bit younger, you might remember this too, where all of a sudden your child was really orienting to something. They were watching something. The example that I've used in classes, and might not be as applicable today because we don't see them as much, are like mobiles that are above cribs. And what you'll start to see is the child will watch something like that for a sustained period of time. Well, that's focus, that's attention. And oftentimes there's a reaction to it. Sometimes children will kick their feet or they'll kind of mimic the sucking motion. And again, that's showing engagement and interest and attention to that object. Now, over time, ideally, what we see are these kind of spurts of growth in the brain that correspond to when, areas of the brain are kind of growing, making more connections. And this is why it's important for us to understand if we're working with a child who then has a history of a neurological condition like epilepsy, where at any point in that kind of period of development, they could have abnormal or problematic kind of either electrical charges in the brain or these kind of observed known seizures. Well, that could impact how the brain organizes itself, how these pathways through the brain are laid down. Because one of the things that we know is that in the same way that we kind of will wear down a trail in a forest, the more people that walk a hiking trail, kind of the deeper and easier it is to see, the more well-worn it is. Well, it's not that different from how pathways are laid down in our brain. So the more times that a behavior is engaged in, the more times that an individual reacts in a certain way or behaves in a certain way, the greater the likelihood that that behavior will be maintained, because that pathway is kind of laid down in the brain. It's kind of already there and the path gets really well worn. Well, if the path isn't laid down the right way, what we can see is that then we can start to have some of these problematic behaviors, right? So again, we think about the fact that there could be a period where the epilepsy could maybe interfere, or we know that sometimes epilepsy can be due to, someone's brain not always developing in the way that we would like, which is the cause of the seizures. Well, that can also cause a lot of these cognitive issues because the nerves maybe aren't connected in the way that we want, or the brain matter itself just isn't laid out the way that it should be. Now, when we think about what attentional profiles or ADHD profiles look like in epilepsy, as a clinician, we do know that it's important for us to consider something like epilepsy, or kind of vice versa. It's important for us to think about the possibility of seizures when we see attentional weaknesses. In some clinics, for example, our clinic, for some individuals who may have a family history of epilepsy, if a child has symptoms of ADHD, we will sometimes do a baseline EEG just to rule out that there's nothing else that's going on in the brain that could be contributing to these issues, because we know that in a really high percentage of individuals, the kind of ADHD symptoms or attentional issues can be present before the seizures are, suggesting that there can be this kind of underlying or more subtle presentation of cognitive issues that happen before the seizures emerge. Now, in addition, we also know that in individuals with known epilepsy, it's far more likely to then have attentional and learning issues. And in addition, one of the things that can be also problematic for individuals with epilepsy is that some of the medications that we use can have the side effect of interfering with attention. They can have these really sedentary effects where people, maybe will speak slower, will talk about mental fogginess, will talk about having a lot of issues in paying attention, which is a side effect of the medication. And in some instances, the benefits of that medication may kind of outweigh some of the risks or some of the issues that someone is experiencing experiencing with their attention. So we have to learn how to manage that, how to best function with it. And the other thing that we know is that individuals who have ADHD and epilepsy, the kinds of presentations that they have clinically look different. The behaviors that they experience look a bit different. Many people, when I talk about ADHD, they think of a really stereotypical individual who can't stop themselves from butting into conversations, can't ever wait their turn. They're always fidgeting. They're always kind of jumping around, moving. They're never paying attention. They're kind of always in their own head. But in reality, what we know is that for individuals who have a history of epilepsy, for a lot of people, the kind of inattention is the most prominent symptom. And what that means is that oftentimes it can be harder to realize that a child is struggling to focus, because again, it's not as obvious as a child who's just jumping out of their seat. A lot of times I'll talk to parents about the fact that it's not unusual for people who have more of this inattentive style to take more time to come into my office simply because they're easy to be overlooked. And especially for a child who is really nice and sorry about that. My headphones might have just decided that they didn't feel like working for a little bit longer. So I apologize for the brief issue there. One of the things that we know, again, is that for some individuals, what can happen is that really that distractibility is what kind of comes forth. And oftentimes I talk to families about what I like to call the double-edged sword of being a really nice kid, where it's easy, especially in the earlier grades, for people to give a child the benefit of the doubt. Oh, Joey forgot his homework again for like the third or fourth time this week, but I know he's working hard. I know that he's trying to get it done. It's fine. I'll accept it. And I'm not saying that we shouldn't meet kids where they are, but what I mean is that because there's not a significant issue, it can take longer for those difficulties to really be identified, and then for a person to get treatment. Now, I also like to talk about areas of kind of stigma or difficulty that can be associated with epilepsy. And the reason for that is that we know that underlying emotional distress, any kind of stressors, anxiety, depression, or just general, upset, one of the first things in the brain that it can impact is our attention. If you've ever been really worked up or worried about something, or maybe upset about a fight you had with a spouse or with a partner, or potentially with a friend, you know that your attention for anything else in that day can really be limited. And oftentimes I will talk to families about the fact that when we say pay attention, think about your attentional resources as a bank account. You only have so many attention dollars to spend at any one time. And if you're spending all of those attention dollars worried about how you're feeling or what you're eating or anything else, well, you're not going to have as many kind of attention dollars to spend when you're sitting in algebra class and you have to pay attention for 45 minutes about whatever equation we're going about today. Now, we think about some of the stressors that can be associated with living with a chronic condition. Certainly, one of the things that we have to remember is that children are not just functioning in by themselves. They are functioning as part of a family unit. And oftentimes the stressors, what we think of as like family mastery, meaning that a family unit is able to cope with the fact that an individual within that family unit is experiencing a chronic illness, whether it's managing aspects of medication, whether it's making sure that that person feels confident and is well able to kind of deal with some of the stressors that can happen, especially in kind of more obvious or overt seizures that can really be frightening to a lot of other individuals, or kind of being able to interact with siblings. Well, that can raise a lot of distress because kids can start to feel like I'm a burden to other people. Kids can really be upset about having to take medications every day of their life. I have a lot of conversations with children and their family about how important it is to be compliant with any medication regimen, because deviating from it can be a real problem, especially because we could have a breakthrough seizure. We could have side effects that come with withdrawal. And we need to make sure that in order to know whether something is working effectively, well, then we have to be consistent in taking it. And in addition, we know that for a lot of either families and teachers, and oftentimes this is something that's more unconscious, but we can have lowered expectations of an individual because there's this known kind of condition that they're kind of working against. And we know is that that when we set lowered expectations, well, oftentimes people, meet the expectations that we set for them. They fulfill the roles that we build for them in our lives. And especially for children, because they look to the adults in their lives to essentially say, who am I? How can I do this? They build their confidence through what we tell them. There's a really great saying that I really think is important of, be careful how you speak to children, because what you say becomes their inner voice. And so if we have these lowered expectations, and this could even take the form of potentially a family member doing things for kids, the message of that is, well, you can't do it yourself. I have to do it. And while that's developmentally appropriate at certain stages, ideally as kids get older, they're supposed to take on more responsibility. And what I see oftentimes in kids who are more dysexecutive, are disorganized, can't plan things out, is that the parents will take that role on because they're not sure how to teach the child to do it independently. And then the child relies on the parent to have it done. But then when they become an adult, or oftentimes, they decide, oh, I want to go away to college, which is wonderful, they fall apart because they don't know how to manage the academic demands, the social demands, and also taking care of themselves, doing laundry, paying their tuition, going to their part-time job, or just balancing all of the things that they want to do. In addition, like I mentioned before, when you're living with a chronic illness, you can have this sense of social withdrawal and alienation. Again, for individuals who have had, maybe generalized tonic-clonic seizures, they can be worried about the fact that, what if I have a seizure in front of other people? That can be really frightening. It can be embarrassing. It can cause kids to then withdraw and not want to make social connections because they're too afraid that someone is going to see this side of them. And that can also come from the fact that seizures can be frightening. They can be upsetting. They're major medical events. And we have to recognize that there are all of these stressors that can then add on to any of the other cognitive issues that are already ongoing for an individual. Now, when we think about some of the things that we typically see with respect to mood, we see, really, upwards of 50% or more of individuals who have a history of epilepsy are going to have some level of emotional distress. And like I mentioned earlier, for some individuals, that can actually be an expression of the seizure itself. So some of the irritability, but also we know that certain seizure medications can sometimes contribute to a child being a little bit irritable or having some difficulties kind of regulating themselves. Now, when we talk about, some of the risk factors for this, obviously, again, like I mentioned, there can be these medication factors, these social factors, and also the presence of these cognitive issues. So when we think about a child who maybe is working very hard, is, academically capable, but they're never quite getting that A because they make little errors in their assignments, maybe because they're missing out on that second page of the worksheet, or maybe because they're never really turn things in. They have all of these grandiose plans, but they never follow through. Well, it becomes this self-perpetuating cycle. They never learn how to manage those skills, and so it continues to make them stressed. And at a certain point, what a lot of kids do is they just back off. They're like, I can't do this. I don't want to do this, even if they're bright, capable individuals. Now, oftentimes when I talk about procrastination, which is probably one of the most common issues that I hear about, working with particularly adolescents and young adults, well, what I know for a lot of people is the fact that procrastination isn't just not being able to manage our time effectively. Procrastination actually is a lot more related to emotional regulation. We tend to avoid things that make us anxious. So the more that we avoid them, we tend to kind of feel relief. And then we just have this cycle that goes until we get to the night before something is due, and then we don't have enough time to get it done. We develop this personal fable of, I'll do it tomorrow. I'll start fresh tomorrow. I'll get to it tomorrow. I have the whole day tomorrow. I'm going to get all of this stuff done. And then it never gets done. And that it increases the stress. And then we're more likely to avoid it. Now, so how do we help? So, I've talked about a lot of these issues. And before we take some time to answer any questions, I want to talk about some of the things that are available to assist when we see some of these difficulties really kind of coming to the forefront for someone. When we think about school-based services, so like we mentioned before in my bio, I was originally trained as a school psychologist, and I respecialized to be a neuropsychologist. So I'm very familiar with, some of the informal and formal supports that can be provided to children throughout elementary, middle school, and high school. school and then can be extended on into things like college entrance exams and then college later on, depending on the university or college that's chosen. So when we think about some of the services which could take the form of a Section 504 plan, which allows a child to function ideally in general education classroom with accommodations, sitting at the front of the room, getting extended time, being able to test in a quiet kind of distraction-free testing environment, things like that. That's one form. Or we can have an individualized education program. And this is essentially where we say a child needs additional supports. We need to change the way that they're taught. And oftentimes this is when we're talking about someone who may have a learning disability, someone who may need additional supports because of language issues or underlying language delays or disabilities, or some of the other medical concerns, or essentially anything else that can be interfering with that person's ability to essentially function in a general education classroom. There's the availability of therapy. Again, we've talked a lot about mood and some of these social issues, and it's really important to recognize that we have to support all areas. We talk just about attention, but it's not just about targeting the attention itself. It's recognizing that there can be several different things that then is interfering with the attention. And oftentimes I'll talk about the fact that if something like our sleep, our mood is not addressed appropriately, you could have the best attentional resources there. You can be the most organized parent there is, and your child is still going to struggle because these things just intrinsically are going to kind of reduce the amount of the attentional dollars that I talked about before. There's also the option of something like executive skills coaching. This is something that I think is a really phenomenal resource. It's something that I've seen both in our organization with one of my colleagues, but also through things like Beyond Booksmart, where essentially you work with an individualized coach to talk about not just learning what executive functioning skills are and talking about how these unique things can, either aid you or kind of get in your way, but also developing this idea, kind of individualized plan for what do I do about it. The thing that I like to emphasize to families is that when we talk about executive dysfunction, it's skills based, meaning that we can teach you ways to work around it. It may never go away. It may always be something that's a relative weakness, but someone who is disorganized can learn to have a routine where they can manage that disorganization and it doesn't get in their way. Someone who often, struggles to plan can learn how to take a project and break it into manageable parts and focus on one thing at a time so that they're best able to follow through and finish things. And the final piece that I think oftentimes is overlooked, but is incredibly important both to individuals and their families, is the provision of what we call psychoeducation. Talking about what it's like to live with epilepsy. What is it like to live with the attentional deficits and the executive dysfunction that we may see in epilepsy? Telling people about themselves. I mentioned earlier on that I talk to older individuals about seeing this as a way to understand yourself. And I think that that's very powerful because we don't often, stop and really understand how well we learn and what techniques work for us and why. This is an opportunity for us to do that and also to talk about some of the resources that are available based on someone's unique profile. And for many people, what I find is that it can be really validating to say it's not that you're lazy, it's not that you're not motivated, it's not that you're X, Y, or Z. It's that, well, yeah, this is a brain-based disorder that can make it a little bit more challenging for you to access these skills, but we can teach you how to do it. There's an excellent saying that I got, I stole from a podcast that I listen to a lot. And if anybody wants to know what it is, you can reach out to me. I'll gladly let you know. But one of the hosts talks about the fact that mental health is not your fault, but it is your responsibility. And I think that's a big takeaway from psychoeducation about managing not just living with this medical condition and things like medication and all of the health things, maintaining a good sleep hygiene, avoiding things that can impair our judgment, like, alcohol or in some instances recreational drugs, but also taking responsibility for understanding ourselves and what works for us and advocating for what we need. I think that's really powerful for children because later on it's going to be something that they need as adults, and that's really something that I take a lot of pride in, that I really think is helpful for a lot of families. Now, in order to kind of contact us and know who we are, NeurAbilities ourselves, we offer a lot of different services. A lot of information can be found at our website. We're on all over social media platforms, but I wanted to take some time to kind of open it up to some questions. I know Ellen is going to kind of direct some of those to me, so I'm going to try to get to as many of them as we can right now to answer as many kind of queries that have come up.
Hi, that was a great presentation. Thank you so much. I
Thank
learned
you.
a lot. I really did.
Wonderful.
And I think I have a little of that, so I had to put speakers on to pay.
No worries. I totally understand.
Our first question is, this person said, I believe you mentioned this, but I just want clarification. Is it possible to have a life that is seizure-free?
It's a really good question, and it's one that typically I would direct to one of our physicians, and the answer is complicated, because it really can depend on, there's, when we talk about epilepsy or seizures, it's a really, really broad spectrum. There's a lot of different kind of seizure disorders. There's a lot of different reasons that people have seizures. We know that someone can be kind of born with a seizure disorder, or someone could have seizures that's kind of an acquired injury. So oftentimes, if someone has a significant head injury or brain injury, they may then suffer seizures. Individuals can also have seizures, for a lot of different reasons, like there's vasovagal syncope and some of these other things that can occur, or can be reactions to drugs. So when we talk about living a life seizure free, it can really depend on what kind of issues a person is having, why the seizures are occurring, and their response to medication. Oftentimes when we talk about being seizure free, it can be something where we are thinking of like seizure free on medication management, and essentially kind of tracking and making sure that we are consistently diligent with treatment. But that's really a great question that's kind of individualized and is best addressed with a neurologist or your kind of physician to talk about what that may mean for you.
How would you recommend starting a conversation about this with parents, teachers, health professionals as a young adult?
That is a great question. It's something that I can break down, in a few different ways. So with parents, oftentimes, the way that I like to talk about it, or the way that I recommend that my clients who maybe are feeling that their parents might not have as much information about it, is to kind of talk about, do you remember when I was a kid? Or in some instances, if they are coming into my office, I might recommend have them come to the session and we can talk about what some of these results are. Generally, I like to refer them to organizations also, such as the Epilepsy Foundation, to talk about, what is epilepsy, what are these attentional research or some of these attentional weaknesses. And oftentimes I'll say, talk to them or listen to either a podcast, a didactic, a webinar like this one, and say, does any of that remind you of me? And that can really be a starting point, because one of the things that I've seen is that when parents are a little bit reluctant to discuss that, it can be because sometimes parents see a lot of themselves in children. I usually use the joke of like, oh, I have a saying about apples and trees. And so sometimes parents can feel defensive, or they can feel like, did I miss something? Did I do something wrong? When in reality, the young adult is like, no, I want to share with you what I'm experiencing. And I think that this resonates with me and I want you to understand it. When we talk about, teachers or school officials, oftentimes it's kind of talking about, qualitatively from what the young adult may be experiencing, but also if you've been followed by a clinician, really kind of roping them in or kind of looping them into the conversation to say, this is what it is that I am struggling with. When we talk about something like, ADHD, like I mentioned before, we have this kind of stereotyped idea of what that means and what that looks like. So when sometimes people who are really high achieving, who are really bright, who work really hard, especially when I hear this from a lot of families where it's like, yes, my child gets straight A's, but it takes them 4 hours a night to get through homework. Or yes, they're doing exceptionally well and it doesn't reflect the work that I put in on the back end to make sure that stuff gets done. I encourage them to communicate that to school staff, because you're right. They're only seeing someone for a really brief period of time, and they might not recognize what this individual may look like if those supports aren't given. And I think, again, it can really depend on what the main message is. Is the main message like, I want to start a dialogue about some of the issues I'm having and I want to talk to someone about it? Or is it, I know what's been going on for me and I want to educate you about it?
Where do you locate executive skill coaches, and is this covered by insurance?
Another great question. So there's many different organizations. Beyond Booksmart's probably one of the best known ones that's kind of all around the country. They have multiple different sites. They do both telemedicine and in person. At our office in NeurAbilities, I have a colleague who also runs executive skills coaching for individuals that is all telemedicine right now. And there's a lot of private practitioners throughout, New Jersey, Pennsylvania, that also provide these services. Typically they are psychologists, but I've gotten some feedback from parents that some occupational therapists or speech therapists also do a little bit of this executive coaching work, although I'm not as familiar with that, so I won't, kind of provide as much information. Unfortunately, this is the downside to executive skills coaching. It is never covered by insurance. Despite the fact that it should be, that is a whole other issue that I can't get into, but it is always self-pay. However, the one thing that I encourage individuals to do is look at different practitioners, because out-of-pocket rates are very, very, very different depending on where you go. So just because one organization may have one rate does not mean that it is standardized. It is very different. I've had a lot of friends who, when I've kind of queried them or talked about, what are you charging for a typical session? I've gotten really different answers. So I encourage you to look at a few different areas to determine if that's something helpful for you.
Can ABA therapies be a form of executive coaching, and what facilities can you recommend?
Well, ABA therapy, yes and no, because ABA therapy certainly is designed to, essentially increase what we think of as these really desired behaviors. Essentially what it is that it reinforces or, encourages an individual to behave a certain way to achieve certain rewards. That's a really kind of very simplistic way to talk about it. Now, the issue with ABA therapy is that in some states, so for example, New Jersey, where I practice, oftentimes the only time that you can get ABA therapy is if you have a diagnosis of autism. It's the only time it's covered by insurance. Pennsylvania is quite different, so I won't, talk as much about that because I'm not as familiar with the system. In terms of specific executive functioning skills, yes and no. It depends on what it is that you're talking about. So a lot of times, therapists may be working on a skill like getting things done, getting started on, let's say, homework. But they might not think about it as executive functioning. They think about it as more rewarding behavior, not needing to repeat ourselves, several different times, but it still can be effective. Now, obviously, if you ask about ABA services, I always, think of NeurAbilities because I'm biased and I think that our therapists are magnificent. However, I always encourage individuals to, kind of look around, talk to either your physician, your psychologist, whoever is working with you, because they may have, and certainly there's many different providers who are absolutely wonderful and who are more convenient or in the area, or that might be a good fit for another individual.
Would executive skills coaching be appropriate for those diagnosed with ASD?
Yes, that's a wonderful question. Oftentimes, the way that I like to think about this is that we want to, make sure that other behaviors that could interfere with something like executive skills or being able to access and consistently implement, these executive strategies are already addressed. So oftentimes we think of individuals who are a little bit more higher functioning, individuals who maybe, are generally, well able to regulate aspects of their emotion and that are really really motivated to engage. That's another thing that I think is helpful and important. Now, certainly when we work with executive skills coaching, if it's an adolescent or young adult, they are usually themselves saying, I want to get this done. I want to get to college. I want to do X, Y, or Z. I don't want to, keep fighting with my mom or dad about what I have to get done. So they may already be motivated to get this kind of up and running. Younger kids, actually, the coaching sessions take the form of working with the child and the parent. And as part of that, we design some of these rewards. It's why when we think about how ABA works, having that motivation factor, actually, they can kind of overlap in a lot of ways. And certainly I've had personally some clients that have had high functioning autism and have absolutely come to me working on the executive kind of coaching strategies and have really benefited from it and have been able to build these skills. So certainly it can be appropriate.
Does a child who's medicated for ADHD react the same way to the medication as children without epilepsy?
Ooh, that is a really complicated question. So I'm going to answer it the best I can. And I always have to give a caveat anytime anybody asks me about medication. I am not an MD. I don't prescribe. So keep that in mind. I'm a PhD. I don't get to wear the fancy white coat, but I do have to learn a little bit about some of how these medications work. So with that knowledge in mind, the answer is complicated. It kind of depends on, is this someone, we certainly know that there are some forms of epilepsy or some individuals who can have what are called these subclinical spikes, where maybe there's not an observed seizure, but the, kind of functioning in the brain is a little unusual. And sometimes those people are or are not put on seizure medication. Those individuals who maybe then are put on an ADHD medication, they may benefit, they may not, but there's individuals with just ADHD that sometimes will respond well to certain ADHD medications and some won't. So it really isn't, it can come down to the fact that years ago, one of the ideas was that you could not treat ADHD in epilepsy with kind of stimulant medication, which is one of the forms of medication that has been put out there, because there was a fear that a child then would be more likely to have a seizure. And what more recent research is suggesting is that that's really not, as true as we might have believed. So there are some neurologists who will say, I feel very comfortable with using this medication. We know that it's something that can really help with the attentional issues. But it really does depend on the individual case. There's not like one size fits all, because again, epilepsy is a really complicated kind of behavioral and kind of neurological issue. And so is ADHD. And since it takes so many different forms, it can be hard to answer in these really general terms. What I can say is that for some people, it can be a very helpful tool if appropriately monitored by someone who has a lot of expertise in that.
This next question, I don't know if I understand it, but are there any differences for a child with epilepsy?
Any differences? I'm wondering if that means like differences maybe in medication or like kind of behavior. So in terms of medication, like I mentioned before, it can kind of depend on, the individual case. In terms of differences with respect to kind of behaviors, yeah, we know that there can be a lot of different either attentional issues that can look a little bit different than what we think of as just the kind of stereotypical ADHD. Learning issues can be a little bit different. It can be more common in this population. So certainly there can be some differences in like behavior and aspects of learning. And if we want to clarify that question, I'm happy to try to answer it a little bit clearer myself.
Are there certain types of therapies that seem to work better than others in executive functioning?
So it's a good question. When we think about therapy, I really separate it out from executive functioning skills. Therapy, when I'm referring to it, I'm talking about working with a clinician to address mood and behavioral issues. And the reason that I separate it out is that really executive coaching skills is meant to be something that is done when all of these other things, our mood, our behavior, our medical status, are a lot more stable. And the reason is because you have to work really specifically on how do I get myself started on something? How do I stay more focused? How do I get myself more organized? When we think about, therapy itself, oftentimes it can depend on the presenting concern. We know something like cognitive behavioral therapy is very, very effective for people who struggle with aspects of anxiety or depression because it's something that it's well researched. But also, it can depend on the individual. It can depend on the clinician about how effective it is. And for some people, we find that other forms of therapy like dialectical behavioral therapy or mindfulness is something that's been a lot more popular recently. And it really can just depend on what a person is looking for. A lot of people think about therapy as just kind of talking in a room for an hour or so, and then you leave and you walk away. But in reality, good therapy should be giving you kind of techniques to use in your day-to-day life to make sure that the mood issues that you're coming to therapy with are being resolved. You're learning how to cope with them and manage them. So, in terms of efficacy, it can again kind of depend on what you're looking for and also the kind of therapist that you might want.
Going back to that question, we were a little confused about. She wanted to know what are the differences for the medication for ADHD and epilepsy.
So it can really depend. I've certainly seen and again, like this is someone who does not prescribe. Colleagues talk about, use of stimulant. Usually we think about like stimulant and non-stimulant medications kind of being used to address ADHD symptoms. And it really depends on what the person is presenting with. It can depend on whether there's, other behaviors or mood issues like anxiety. A lot of times, some of my colleagues will talk about not wanting to use certain stimulant medications if anxiety is present, because sometimes it can make the anxiety worse. So yes, there can be differences. And it's why I think it's important to work with someone who is, well versed in working with people who's familiar with, something like epilepsy and ADHD. Just like anyone can be specialized in a certain job, neurologists, certain neurologists can feel very comfortable in working with this kind of a case where it's kind of complicated with some things, where other people might not be as comfortable working with it. But certainly there can be differences in terms of treatment protocols.
It's kind of like along the same lines. Does seizure medication interfere with ADHD meds?
Oh, that again, very complicated. I can say that, like I mentioned before, there can be the side effect of kind of people being a little more lethargic, kind of not being as active. Whether or not there's a direct effect on kind of ADHD medications, thinking like a stimulant, it's a little bit harder to say. That's something that would be best addressed by a physician who really kind of deals with that day to day.
All right. I think we're at the end of the questions. There's a lot of thank you so much for the presentation. I can't wait to bring this
Absolutely.
back to people.
Wonderful.
Yeah, so I guess we're going to sign off and thank you so much for this wonderful presentation.
My pleasure.
We have recorded it and it will be published to our YouTube channel. We have a lot of YouTube videos that there to, and so if you want to share this with a loved one or a friend, it should be up within the next few days. And you just look for our Epilepsy Foundation YouTube channel, Epilepsy Foundation Eastern Pennsylvania.
Perfect.
Right.
And if anyone is interested, there are some kind of similar webinars and things like that at our NeurAbilities website too, that cover a lot of different similar kind of things. So I encourage you to look at both sites and get as much as you can. Thank you so much for this opportunity.
Thank you. Have a great
Thanks.
night, everyone.
Thanks. Bye-bye.
Bye.